So I had a very early exposure to the world of psychiatry. When I was 7 or 8 years old, I was briefly prescribed Paxil for separation anxiety. And I remember, taking these medications, but particularly when I was coming off of medications, I just had a very early memory of going into my mother's bedroom because she would cut little slivers of the Paxil pills to give me every night. She would notice, that I was just not myself when she was just giving me a lower dose based on the psychiatrist's recommendations. That kind of stuck with me, that early exposure to medications and mental health and anxiety.
That is a powerful story. So you had personally experienced the withdrawal symptoms from an antidepressant. Let's go to the special report, because you start by making the point that this is not just something that happens here and there. In fact, the people who are at risk for antidepressant withdrawal, the numbers are high, and the condition has been in fact recognized as a diagnosis. Now we're looking at an antidepressant discontinuation syndrome, right?
Yes. And there's a lot to discuss here, because even the term antidepressant discontinuation syndrome is a little bit of a euphemism that at least gives the perception that this is a more mild, kind of condition compared to an actual withdrawal syndrome.
The overall incidence of withdrawal is high. So you're quoting a systematic review, which gives a range which goes from about 33% to 56%. So that's 1/3 to a little bit more than a half of the patients who are facing, a scenario of dose decrease or discontinuation are at risk for experiencing those symptoms. That's a high number.
It is. And 1 in 8 American adults are prescribed antidepressant drugs, 1 in 5 women. This is millions of Americans we're talking about.